Late afternoon session on unraveling the biology of the hypnozoite. My name is Jessica Lynn. I'm from the University of North Carolina. And my co-chair, Dr. Kevin Baird, is from the Eichmann Oxford Clinical Research Unit in Jakarta, Indonesia. So I'm an MD. I became interested in this topic nearly 10 years ago when I was following patients with falciparum malaria in Cambodia. And I realized that in that region of the world, where there's been really intense focus on artemisinin and resistance, our study subjects were actually more likely to return with bouts of recurrent vivax malaria due to failure to recognize hypnozoite infection rather than ACT treatment failure. And at that time, I resolved to work on this subject, probably before fully realizing how hard that would be. As most of you know, culturing blood stage vivax remains a challenge, and we're still missing the tools to know who's suffering relapse from vivax or who is actually silently carrying hypnozoites in their liver. So, over the last 10 years, several groups have really been using cutting-edge technologies to develop in vitro models of liver stage vivax infections, while others have started to integrate genetics and genomics analyses into study designs which incorporate those who relapse outside of endemic settings. So these different projects have been motivated by sort of the urgent need to develop and test drugs for vivax malaria, but I think that one of the side benefits is that they can help us to better understand how relapses work and really bring us closer to that question of how relapses are triggered. Is this an intrinsic mechanism that's based on a genetic clock? Is it extrinsically triggered by some epigenetic mechanism? Or do reactivated schizons simply leak out of the liver and sometimes they become patent or cause symptoms? And that's when we discover them. Is it a combination of all of these? So my hope was that by having a session that brought together basic scientists, epidemiologists, and clinicians, that we could start to sort of integrate some of their findings and get a little bit closer to answering these questions. So I just wanted to say a little bit about structure. The times in the online planner are sort of jumbled, but basically after an introduction from Dr. Baird, each of the speakers will have 15 minutes and we can have questions after each of them and then questions at the end.